ask questions. This course is different from other courses. It's different from other courses because it is designed to give you that competence to carry out your project. Yeah, your project. Okay. So you interestingly, I must say that we are almost through with our third courses. We are almost through with our third courses. Those in the MPH program, they still have a course in environmental health, environmental and occupational health. They still have that. And then while the occupational medicine program, they are virtually through with their courses, except this course on research methodology and management and entrepreneurship, which are courses of our own School of Graduate Studies. Okay, so please try to understand and how we are. If you notice, if you look at the lecture shadow, you will notice that you will be taught for now this year, you only be taught how to choose your project and how to write your proposal, research proposal, and that is the only thing we are going to teach. By next week we even start another course because we don't want to. We have acknowledged the fact that this our master's program is no longer. It's not for 12 months.
Hello, Professor. You're speaking. We can't hear you. I can't hear you, sir. I don't know if others can. You're very low, sir.
Hello, can you hear me?
Yes, sir. Yes, sir.
Yes,
Speak
we
loud.
can hear now.
We can hear you,
Now
sir.
that you can hear me.
Yes, we can hear you now.
Can you hear me now? Hello?
Yes,
Yes, Prof.
we can hear you now.
Yes, yes,
Yes,
Prof. We
Prof.
can hear you now. You can go ahead, sir. Thank you.
Okay, sorry, I'm using another device, but you can hear me.
Yes, very clear.
Very well. Very well, sir.
Okay,
Thank you.
okay, so apologies. Probably there is a what is it called now? Okay, so I was just saying, sorry, I have dissipated my energy saying a lot of things that you didn't hear. Let me just say that probably I have to repeat what I said, that this course is actually our graduate school course. And we are almost through with the third courses. We are almost through with the third courses in the sense that those of you in MPH, you are taught two courses in health management. Is because MPH is actually designed to be a professional degree. So you needed that training on health management for a successful career. And then those of you in on occupational medicine, you were also taught, you were taught the principles and practice. So, but for this course now, this course is to give you the competence to carry out your master's project. Is to give you the competence to carry out your master's project. Okay, so it is unlike other courses in the sense that what you'll be taught, the guidelines, what you'll be taught in this course are those things that we are told to teach you by our graduate school. So the graduate school has a protocol, and they have requested that we teach you this protocol. The only thing that we have to commend them that they graciously allowed us to be the ones teaching this. If not, they could have appointed an external person to do that. Okay, so we can go that. Let's say that this course, this research project is considered as a 6 credit unit course, which means that it is double. It is double the credit unit of most of other courses. And then, so if you do well in the project work, it means that you stand a chance of having a better grade of degree, and your CGPA will increase significantly. That's why you have to put a lot of effort. You have to put a lot of effort. In fact, this slide should be a companion. This slide should be a companion as you write up, as you conduct your research and write up the dissertation. It should be your companion, please. Just regard it as your companion. So it's not just what you just leave. And even I think we have to say the truth. Even when if you have contracted the work, the research work to another person, please ensure, just give that person these the lecture slides which we are going to give to you to guide him, because your dissertation will not be accepted except it is written according to the graduate school format. Please, I beg you. I beg you. Almost every university has its own format. Every university has its own format. So you have to conduct your research, write up the dissertation in the format that is approved by the University of Port Harcourt. Please do that. So either you are the one writing it or you have engaged someone to write it on your behalf. Please use our graduate school format. Please use our graduate school format. Okay? So this course is to give you that competence to carry out the study and write up the dissertation. Okay, and in the School of Public Health, you know, our programs are both academic and professional. So we will encourage you to choose a topic, to carry out research that can be described as translational research. A translational research is a research in which the findings of the research can be translated, can be transformed into products or services. Okay, so that's what we want from you. So the processes involved in carrying out this research project we have listed them in these steps. They include the choice and approval of research topic, assigned supervision, research proposal, ethical clearance, conduct of the research, submission of dissertation, plagiarism test, publication of the article, and then the defense of the dissertation. These are these steps. These are the processes you are going to undertake before the completion and defense of your thesis. In fact, we have added an additional one, and that is the presentation of your literature review. We have added it because we want you to have an in-depth knowledge in that area, in your area of study. So if you decide to do a study on maternal mortality, you must know more. You must have an in-depth knowledge of maternal mortality and not just that small aspect you are going to carry out the research on. Okay, so that is it. So these steps, we are going to go through them one after the other. The first one is the choice and approval of research topics. The choice and approval of the research topics is what we are going to do. In the next 1 week or so, we'll expect you to submit some research topic, probably about 3 possible research topics, from which we are going to approve 1 for you. Okay, so these processes, yes. So we expect these choosing a research topic. Choosing a research topic, you can accomplish it using 7 different steps. 7 different steps are needed for you to choose a research topic. And we are going to go through these seven steps in this lecture. We are going to go through these 7 steps in this lecture. The first of the step is choose a topic that is relevant to your program. Choose a topic that is relevant to your program. So we know we have different programs. So your topic must be relevant to your program, because remember that you'll be awarded that degree. You'll be awarded a Masters of Public Health, or Master of Science in Occupational Medicine. The topic, your research topic, must be related to your program. The second step is that you have to leverage on your background and experience. Leverage on your background and experience. The third step is have the right mental disposition. To carry out a research, you must have an inquisitive mind. So you must have the right mental disposition. The fourth step is that you must know your capacity. Know what you can do and what you cannot do. Okay. The fifth step is you can choose a research topic based on, yes, you can now choose a research topic. And even in choosing a research topic, you must know there are certain known unknowns, certain things that are difficult. They are difficult to know at this time. They are difficult to know. Certain things are difficult to know. Right now, we don't know. We can't see angels. We can't see angels. So you cannot say you are carrying out a study to measure the diameters of the height, to take the anthropometric measurement of angels. It's not possible. So you must recognize there are certain things you cannot do. And please shy away from them. And don't give us those topics. Okay? And then the 7th step is ensure that yes, research studies are smart. 7 steps. We are going to go through them one after the other. We are going to go through them one after the other. Okay, so the first step is to choose the topic that is relevant to your program. Choose a topic that is relevant to your program. I must say, so remember that your research, your dissertation is in partial fulfillment for the award of the degree. Partial fulfillment, which means that topic must be relevant to your specialty, must be relevant to your specialty. And I must say that for most studies in public health, most studies in public health are called epidemiological studies. They are called epidemiological studies because they involve human beings. They involve human beings. When you carry out a study with human beings, with large numbers of human beings, as we do in public health, it's called epidemiological study. It's called epidemiological study. Epidemiological studies are different from other studies. They are different from other studies because other studies, you can subject them to harm, like guinea pigs. If you are carrying out a study in the lab, you can introduce poison and then watch how the animals react to those. But you can't do that with human beings. Okay, so that's why epidemiological studies are very special studies designed to be suitable for use amongst human beings. So most of our studies will be epidemiological study. I'm sure that in those when you were taught when you are taught epidemiology, I'm sure that they mentioned epidemiological studies. They mentioned. Let me say that MPH is generic. MPH is general. Should I call MPH a general practice?
Sir, we can't hear you.
Hello? Hello?
We can hear you now. We can hear you now.
We can't hear you.
No, we can hear you.
Yeah, can you hear me now?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes.
We can hear you, sir.
Yes, sir. We can hear you now.
Yes, sir, we can hear you.
Frustrating. Okay, it's all right. If you can hear me, I'll make. I think I will just. I won't use my. What is it called now? Okay, so we can. So most of the studies you are going to do will be epidemiological studies, and then epidemiological studies, and epidemiological studies are carried out amongst human beings. And then, of course, the thing there is different from studies carried out in animals, because you cannot possibly give poison or things that are potentially dangerous to human beings. Okay, so those of you in epidemiology, in MPH, you are free to do any study that is relevant to public health. Remember, public health is broad. Public health is defined as anything with the capacity, anything that anything that is done to improve the health of the public. So you can do anything. And public health, MPH is like the general practice of public health. So all aspects, you can do studies. You can do studies on studies on epidemiology itself, on health systems. Remember, you did even 2 courses in health systems. Occupational, you can even do on occupational medicine, on environmental health, take samples of the environment, measure noise level, air quality, and then find out the effect on human beings. Population and reproductive health. Remember, you did a course in population and reproductive health. You can choose a topic in population and reproductive health, maternal mortality, family planning, adolescent health, harmful traditional practices, anything on population and reproductive health, you can do that. And community health, you can do things on community health. If community-based studies you can carry out. You can do study on public health nutrition, food safety, nutritional needs, anthropometric measurements, you can do that. Even in health communication, you can do. Okay, so those of you in MPH, you have a lot of topics, a lot of possible topics you can carry out the study on. Then those of us in occupational medicine, of course, occupational medicine, you can choose topics that are related to both the practice and the principles of occupational medicine. The principles of occupational medicine are related to the hazards, the occupational hazards, and of course, the hierarchy of control that are used, hierarchy of controls that are used to control these occupational hazards. You can carry out your study on them in any aspect of them. And of course, the practice of occupational medicine, including occupational health services. How do you make occupational health services available to everybody? Remember, there is a concept called occupational health for all. In that even those in the informal sector can or desire or deserve occupational health service. So occupational health services are not just for those in the formal sector or the rich workers or rich companies providing services for their staff. But you know that occupational health service, the provision of occupational health services is even mandatory. All employers of labor are even mandated to provide occupational health service to their staff. Okay, so we should be able to choose those topics. We should be able to choose those topics, and those topics must be relevant. They must be relevant. So I don't know if, although I have been, you have not had me for a lot, but I don't know if you have had enough to ask any question or comments. Is there any question or comments that you want to make? Questions, comments? Yeah, do you have any question? I know that I've not been heard from some aspects, some period of the lecture. But do you have any question on the topics? On the topic?
Prof.
Yeah.
Prof. Hello?
Yes, Alex.
Sir? Okay, please, I have a question. If concerning the topics now, somebody that is not in Nigeria, can we make a topic based on the country we are, or we must make it relevant to in Nigeria?
Yes, sir.
No. It can not necessarily in Nigeria.
Okay, thank you, sir.
Not necessarily. It has to be relevant to occupational health. Yes.
Okay.
Occupational
All right,
health.
sir.
Yeah.
All right. Good
No
evening,
problem. Thank
Prof.
you.
Yeah. Look.
My own question is, can somebody do anything on cardiovascular medicine?
Yeah. Cardiovascular risk assessment is there, but it's not purely clinicals. Is when it is entirely clinical, that's when we may not, because this is public health. Mm-hmm.
Okay, sir. Thank you, sir.
Yeah. Yes. Is there any other thing? Any other? Okay. So we can. So the first one is that you must choose a topic that is relevant to your program. And those of us in the MPH, you don't have a lot of problems because MPH covers a lot of things. And occupational medicine, it must be related to occupational health, to either the principles or the practice of occupational medicine. In fact, in recent times, we are also beginning to encourage people to look at the feasibility of providing occupational health services to the informal sector. To the informal sector, because it's also we also have the professional aspect. So we want to see if one can even think of setting up an occupational health service to serve the informal sector. Okay, so the next step is for one to leverage on one's background and experience. After leverage on your background and experience is important. It's important. Okay, hello, Chinedu.
Yeah, thank you, Prof. Good evening.
Good evening.
Yeah, I want to ask a question. You said when choosing our topic, you should leverage on our background and experience.
I'm just trying to introduce it.
Yes, I want to just ask a question regarding selecting a topic. Some of us here work together and we share common background and experience. What if in choosing our topic and the topics are similar? Will it affect, like one person's topic will not be approved and the other person's approved? Will such thing happen?
Although, to tell you the truth, anyway, I must confess, that in the last in the PhD students we are working up for their final defense, we suddenly realized that substance abuse. Three of the students did work on substance abuse, although the only difference is that they have done it in different population.
Okay.
Okay, so that is that. Okay,
Yep.
so if I continue with this one on leveraging on your background, we define public health as anything done to safeguard the health of the public. Okay, so and our admission policy is very liberal, open to almost everybody, including those in the arts. We have admitted accountants, those that did accounting, those that did even hardcore theater arts. We have admitted them. Okay, so why we have so which means we expect them for their research. We'll expect them to leverage on that background, to bring that into public health, into public health. So if, for example, pharmacists, they can do something. They know a lot about drugs, so they can do their research study can be on drugs, especially essential drugs, which are drugs that should be available at all times, at all times in a health facility. Microbiologists, they can take swabs and analyze environmental samples, door handles, rails, air quality. They can, they can carry out the study. One student actually did air quality of the air quality in different clinics of a teaching hospital, and found very interesting microorganisms airborne. Okay, so you can leverage, you can use your background, and then if you're already working, please, you can use your work experience. Especially if your work is related to public health. So those of you in the NGO, working with NGOs, with NCDC, any public health, any public health agency, you can actually use the data generated in your workplace for your research. The only thing is that you must get consent from your bosses before yes. But once they give you the consent, we will encourage you to do that, because you already know. Remember that we want you to do a study. We want you to do studies. We want you to be an expert in that area you are carrying out the study. In the area you are carrying out the study. In fact, we are also trying to ensure that, because I personally have seen a student. In fact, it was computer science. She did computer science, and then she was, I think today she was trying to defend a dissertation on diabetes. Although she said she did our PhD, but she was presenting something on diabetes. But to tell you the truth, it's not that one cannot do that, but it means that you must take time to read a lot about that subject, the subject that you don't know much about. You have to spend more time to do that, so that the basic things, you should know the basic things, because the external examiner who will assess you at the end of the whole thing may decide to ask you questions outside the dissertation. For example, if you are doing a work on hypertension, they may probably ask you how they will expect you to at least know how to measure the blood pressure. Okay? Know how to measure the blood pressure. And the good thing is that you can learn. You can learn. You can know it. You can know it. Already we have short courses, but apart from those short courses, you can, whatever, there is nothing you cannot learn. This is a good period to be a student because you can, the AI is there, the internet is there, the YouTube is there, videos, you can easily get videos that can teach you how to do anything. How to do anything. Remember, there was one, I think a Kenyan, that became an Olympic champion, a javelin Olympic champion. And he said he learned how to throw javelin by watching YouTube video. Okay, so that's nothing. But a lot of us are lazy, and if we are lazy, the best thing to do is to leverage on your background because you already have that knowledge. Then use it, apply it, use it for the study. And another thing too, if you are working, you may not have time to go out to collect your data. So it's better you use the data that you have in your workplace. So you don't need to start going out when you have the data in your workplace. Okay. So I have some hands up. So we can start with I think Eze. Eze's hand was Eze. So hello,
Good
Eze.
evening, sir. Mesomachi. Yes, is it the Mesomachi, sir? Yes, good evening, sir. So I wanted to ask, is there any possibility of like working in groups or pairs or anything like that, or is strictly a personal work, a personal project work?
Yeah, you are indirectly asking what the other guy asked. If people can do the same topic.
Yeah.
I must say that I must say that I know that at the at the undergraduate level, we have let them do that. But right now, our university hasn't approved it. So, but what you can do something similar, but in different population groups.
Okay.
For example, you can do something on hypertension, prevalence and something on hypertension, but in different groups.
Okay, sir.
In different groups, in different study population. Your own can be on clergy, others can be amongst lecturers, others can be amongst traditional rulers, etc.
Okay, sir.
Yes.
Thank you so much, sir.
And in fact, at the end of the whole thing, if you are working so closely, you can even begin to compare the findings. Okay. And instead of having one single, single strand study, you can now have a comparative study. You can now compare your findings with his own finding and things like that.
Okay, sir. Thank you so much, sir.
Okay, well done. Ojubayo. So Tayo. Hello, madam.
Hey, Jesus.
But your hand is up now.
Sorry,
Are you
sorry,
surprised?
I was trying to unmute. Good evening,
Okay.
Prof. Thank you, sir.
Good evening.
So my question is, since you said we can use data from our workplace, so I want to ask, is it possible, can we also use data like from NDHS data?
Yeah, NDHS.
Yes, sir. Then my other question is it possible we also do a secondary research, like a review study or something like that?
Yeah. That is using a secondary data. You can.
Yes, sir.
Yes, you can. But yeah, secondary data, especially when you have a large pool. with secondary, with large pool, you can do a lot of analysis. So it's the analysis that will bring out the that will make it very, very interesting. Okay,
sir.
Okay.
Can we also do a review, so maybe review of past primary research?
Okay, what they call a systematic review.
Yes, sir.
That's where no, because we want to get you to do that in your literature review.
Okay, sir.
Yeah, we want to force you to review literature and know a lot about your area of study. Okay.
Okay, sir. Thank you, sir.
Adeola.
Oh, thank you, sir. You have answered my question on secondary data, but my second question is on ethical approval if you are not within Nigeria.
If you are not within Nigeria and you are carrying out a study, you must get ethical approval from an ethics committee in that country. For our foreign students, we expect them to get that. But our university expects all our students to have the ethical approval of our research ethics committee. So which means that if you are doing a study outside the country, you're likely to have 2 ethical approvals. But to tell you the truth, a lot of places in Nigeria, if you go to teaching hospitals, a lot of the teaching hospitals are insisting that you even go through their own that you even apply to their ethics committee, which is not actually right. Because ethics committee, they work with the same protocol. So if one finds your work ethically correct, it should be recognized by the other committees. But if you are carrying out the study outside the country, you must get their own ethical committee. Yeah, it is ethical approval. Okay. Hello, Suleiman.
Good evening, sir.
Good evening.
Well, thank you very much, sir. I want to take us back to the conference that the school organized a few months back. Really appreciate the efforts of the school. I also wanted to know if it's in the school's plan to make that an annual event.
Yeah, it will be annual. It will be annual.
Then for those who presented, is there going to be like a separate document to reflect the...
Okay, that they presented?
Yes, in the conference, sir.
That is not traditionally, I don't know, but that is, anyway, probably we'll have to explore that. But what is usually done is that there is what they call the book of proceedings, conference proceedings. And those conference proceedings are, once you submit your abstract, you present it, comments are made, and then you'll be expected to reflect those comments before the abstract will now be published in the conference proceedings. That is the usual thing. But that is how such abstract presentations are recognized in most conferences. But usually certificate of attendance are given, and then the book of abstracts, it will be presented to show that the person presented it, but usually not a separate certificate of presentation.
Okay, thank you very much, sir.
Yes. Hello, Mary.
Good evening, sir.
Good evening.
Good evening, sir. So I wanted to know if we can take our data from maybe a retrospective, something that like I work in a hospital setting and I want to know maybe back then, maybe for the past 5 years, and a number of infant mortality or neonatal mortality. Is it acceptable by the college?
Yeah. That is why we call it, what is it called? We call it secondary data. Secondary data are collected for other purposes. They are collected for other purposes. Okay.
Thank you, sir.
So you can. You can. But we must also acknowledge although secondary data, the sample size, you have a lot. You have so many. But the only problem is that secondary, you cannot, there are certain information you cannot get from secondary data. Secondary, you cannot generate new information. You can only manage the data already collected, already contained in that secondary data. You cannot go outside of it. Let me not say can. There is nothing that cannot happen. It is difficult to go outside of it. Okay, so thank you very much. So we can go to the next step, which is the one on the right mental disposition. I added it because we Nigerians, we are very, very religious. And then because we are religious, we try to interpret things based on our religious beliefs or cultural beliefs. In Africa, we believe in miracle. And in science, should I say that science don't believe in miracle? And we have to also know that's what is called a chance occurrence. Chance occurrence. In science, chance is actually defined. Chance is anything that happens less than once every 20 times. Anything that happens less than one. And that is why you will see what they call the p-value of 0.05. That 0.05 is that it is not a chance occurrence. If it is less than 0.05, it means that it is not a chance occurrence. Okay? So which means that that's why in that lecture, in the first lecture, we are talking about, I said, my favorite medical personality, especially of Islamic medicine. I said he was Moses Maimonides, a man that was a rabbi and a very good doctor, so good that he became the court physician of the palace physician of Salah ad-Din, one of the greatest Muslim caliphs. Imagine a Jew being a court physician of not an ordinary caliph, Salah ad-Din. And that is because he was able to combine science with religion. Okay, so just look at this. I will show you some pictures. Look at this. What do you think when I'm sure you must have heard that witches can actually travel long distances just on a broomstick. On a broomstick. So if you hear such things, what is your disposition? How do you explain it? Do you think it is possible or not? When a woman that is described as barren because she has probably stayed more than 10 years without giving a child, without becoming pregnant or giving birth. If she gives birth to triplets, what do you think has happened? What do you think has happened? So you can answer in your mind. You can answer in your mind. And when a boy who was said to be deaf and dumb from birth. What happens when he becomes healed and he starts speaking? What do you think has happened? What do you think has happened? And what do you think, knowing fully well that you can only speak the language you have heard? So if somebody has been deaf and dumb, which language has he heard? Because we are not born preloaded with our native language. No, we are not born preloaded with our native language. We learned from what we had. Okay, we learned from what we had, and that's why even if you are married and Yoruba man, and if you speak English at home, your children may not understand Yoruba because they weren't born preloaded with Yoruba. They had to hear. So some of those things. I know that in some Christians believe in this statement. God said it, I believe it, that settles it. Which means that you just, whatever you hear, you believe. You believe and you don't question. You don't question. Unfortunately, human beings are not created to be that way. Human beings are created to always question, to be inquisitive. If you have a young child, you will notice that the child will be asking questions. Mommy, what is this? What is that? Why is this so? Or that and that and that and that. Is because that is how human beings learn. That is how human beings learn. And then we have to go back to the Hebrews. The Jewish race. They have one of the highest number of Nobel laureates, and it is said to be because of the way they were trained. The way they were trained. The Hebrew child is trained to dispute, not to take everything. Hook, line, and sinker to dispute. In fact, the coming of age of a Jewish child, is marked by his coming to dispute, to ask questions, tough questions, and that's why the Jews became very good lawyers. So you cannot be a good scientist without questioning. If you want to be a good scientist, if you want to do a good research, you must not accept everything, no matter who has said it. You should question it, subject it to research, and either prove or disprove it. And it is yielding in medicine, or even in the health sciences. That is what they call the evidence-based medicine. Evidence-based medicine, that medicine that before you practice it, a procedure must be shown to be effective before you use it. And it's also changing. It's changing our practices. It's also changing our medical practice. When I was training in medical school, we were told that all women giving birth the first time, people they call primips, you have to give them episiotomy. You have to give them a cut to let the baby come out. You have to give them a cut to let the baby come out. Okay, but right now it has been found that episiotomies are not to be used that way. And that is what they call the evidence-based medicine. Okay, so, and then this man, I'm sure that you must have heard of him, Claude Bernard, a prominent physiologist. Those, of course, He was the one that brought that concept of milieu interior, internal environment of the internal environment. He once said that it is through experimental method that science is carried forward. It is through experimental method that science is carried forward, not through uncritically accepting the authority of academic or scholastic sources. So no matter who said it, you shouldn't accept. So according to him, when we meet a fact which contradicts a prevailing theory, we must accept the fact and abandon the theory, even when the theory is supported by great names and greatly accepted. Although in occupational health, we still teach the legs aphorisms. We still teach the legs aphorisms. Okay, but it is actually for anyway. We are not expected to take it hook, line, and sinker. Yes, aphorisms used to be very, very common in medical practice, especially because medicine used to be an apprenticeship. So masters had to break down the practice into aphorisms. So that was how they were teaching. But right now, aphorisms are no longer in vogue. Aphorisms are no longer in vogue. You question everything. You question everything, and you subject everything to scientific research. You subject everything to scientific research. So that's the right mental disposition. Question anything. Question anything. But question anything, then carry out that research. Carry out that research. Okay, so the fourth step is that you must know, even if you are to question everything, you must know your capacity. You must know your capacity. You must know your capacity. And in knowing your capacity, especially for this master's program, you must know that you don't have a lot of time. You don't have a lot of time. You don't have a lot of time. You have spent most of the time on the third courses. You don't have a lot of time to do the project work, probably maximum 6 months or so. So you cannot do a study that will last 1 year. You shouldn't do a study that will last 1 year. So you don't have the time. You don't have the time. You should do a study that within 6 months you are done. And that's why we recommend that you do cross-sectional studies. And that is the reason why we said we recommend that you should do cross-sectional studies. Cross-sectional studies are studies that you study the respondent once. You study the respondents once. Okay? You study the respondents once. So we have several of them. Several of them. And the one we prefer want you to do is the analytical cross-sectional study. Already some of you are saying, okay, you can do the same, but you can compare them, you can convert them to comparative study. Comparative studies are 2 studies in one. 2 studies. You study in 2 populations and then compare them to find out if there are statistically significant differences between the 2. Okay? So you have to know your capacity. And that's the first thing you have to consider is, can you complete this research within a short time, maximum 6 months? And this 6 months includes everything. 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 In fact, we have accepted the fact that this our program can be even an 18-month program. We have even accepted that fact because students they can't finish. They can't finish. Probably around June or so, it will be 1 year. It will be 1 year since you started this program. It will please us if you are able to complete your work within that before June. But it is difficult. It is difficult. So we want you to do a study that you can complete within a short period. But there is also an additional thing that you have to consider when it comes to the capacity, when it comes to the type of study you will choose. That is the money, the resources needed to carry out the study. And for a research study, the resources needed for a research study include money, the logistics, assessment tools, and the statistical backup. These four things are needed: money, logistics, assessment tools, and statistical backup. Okay, but as you can, if you have money, you can. Money can pay for a lot of for the rest. Money can pay for the rest. Unfortunately, we don't. Most of you, you are a lot of. Unfortunately, you may not get grants, research grants for your study, which means that you are going to use your personal money. You are going to use your personal money, and we don't have. A lot of us don't have a lot of money. So it means that we have to consider the money, the financial costs of the study before deciding. The financial cost of the study before deciding. Then the other one is the logistics. How do you gain access to the study population? How do you gain access to the study population? How do you guys, if you are conducting a community-based study, how do you get access to the community? Because if you sneak into the community and they recognize you as a stranger, they can tag you a militant. They can tag you a kidnapper. They can tag you even a herdsman, and you know what can happen. The person can be lynched. That's why you must have a way. You must know how to assess the community, and assess the community by getting close, getting in contact with the community leadership and paying homage, and then they will help you with it. Okay? And then the other places where people do health facilities, primary care centers, general hospitals, teaching hospitals, you know that you cannot just go to a hospital and then start sharing questionnaire. You must get the permission. You must get permission from the people. And we are also beginning to have problems because hospitals are now insisting that students go through their ethical committee before they will be allowed. So there are problems too. And then even for secondary data, including SOMAS. SOMAS is an electronic platform that where diseases are reported. Disease outbreaks are reported in Nigeria. So you have a rich pool of data that you can study. And this SOMAS is under the control of NCDC. So you must have their permission to access the SOMAS platform and carry out the research. Okay, so the School of Public Health is also we help you in gaining access to these places, communities, the hospitals, and the rest. We can help you, but at the first sign of difficulty, you have to make a change. Don't leave it too late because you don't have time. If they are having problems, if they are giving you a lot of conditions, please change immediately. Change immediately. Okay. Then the assessment tool, you need assessment tool. Those of us in occupational health, we want you to measure the hazards. We want you to measure the hazards. We want you to measure noise level. We want you to measure air quality. We want you, if possible, measure irradiation. Measure all those hazards. If possible, if you suspect biological hazard, take a swab. We want you to do that. And the problem is, so these hazards, physical hazards and the rest, they require special instruments, special equipment. You may not have the money. You may not have the money to buy them, but there are places where you can hire. There are places where you can hire. You can, our sister center, Esputo, they have bought some. They have bought some equipment. So these equipment are available for hire. You can hire. But usually you hire not only the equipment, but the person that will help in measuring the hazards. So, which means that one of those things you have to consider is the money. You have to consider the money to hire not only the equipment, but also the person that will do the measurement. Okay. The other one is the statistical backup. Statistics. You are going to do cross-sectional study, but you will not go do descriptive because you are expected to analyze your data. The lists we will accept is what they call the bivariate analysis, in which you cross-tabulate two tables, at least two tables. That is the list. That is what they call at least the 2x2 or the contingency table. That is what we'll expect. So, which means that you may need a data analyst. You may need a data analyst. Okay, you may need a data analyst. But if you don't have money to hire a data analyst, you can learn, because they have statistical softwares are now available, which you can easily learn. And we have said that you can learn virtually everything. You can learn virtually everything. You can learn virtually everything. So if you don't have money to pay the data analyst, you can actually learn. And when you learn, you will use it for your project, and it can even become a data analyst. The School of Public Health has a lot of students, so you can analyze not only your own, but also help your other classmates analyze theirs, of course, for a fee. Okay. Okay. So I don't know if there are questions or comments on what we have said so far before we move on. Questions, comments? Any question or any comments? Okay, Augusta.
Good evening, Prof.
Good evening.
Okay, I want to ask for the sharing of questionnaires to get your data. Must it be hard copy? Can't we do soft copy?
No, it mustn't be hard copy. It can be soft.
Okay, thank
and
you,
of
sir.
course, you can be. There are some soft copies that are also interview administered, which means that you can. It will be a tablet, and then they just fill it on behalf of the patient, how they responded. Okay.
Okay, sir. Sir, please, in the School of Public Health, is there a library or where
we have
research work has been done?
Yes, we have a library, and then we can also make that available. Because the library was passworded. So if you need it as it's needed, we made it available.
Okay, sir. My last question. In choosing a topic, we are going through the process. So, sir, can someone choose a topic that has been done previously, maybe in the last 5 years or 2 years? I don't know. I'm just confused.
Anyway, there are some. Anyway, we are getting into that. We are getting into that.
Okay. Thank you, sir.
Yes. So we can now go to the choice of research topic. The choice. Yes, you can. There are ways you can choose a research topic. A research topic from an old research study, old research. So old research you can choose. You can choose research topic from personal experience. Your personal experience in the community, in private life, wherever, and from the lecturers. So which means there are three sources. There are three sources of research topic. From old studies, from your personal experience, and then from lecturers. So these are the three possible places to look for the research topic. For the old topics, you can from old topics, there are usually in chapter 1, that is what they call the justification. You have to justify. If you choose a research topic, you must justify it. And there are probably two important questions: how to justify a study, have previous studies been carried out, and if yes, how is your study different from other studies? What they call the research gap. So you can carry out you can repeat an old study, provided in these 4 circumstances. The first one, if there are new criteria, new diagnostic criteria. The second one, if you want to use another methodology, study methodology. The other one is you want to repeat it in another study population. And the other one is if it has taken a long time since the first study was carried out. So I'm going to repeat that in choosing an old topic, just as we're just asked now, there are 4 ways you can choose an old topic. The first one, if the diagnostic criteria has changed. The second one is if you want to use another methodology, study methodology that is different from the one that was used in the first study. The third one is if you want to do it in another study population. Remember, we told you about the hypertension. Hypertension is increasing, or even diabetes, all those non-communicable diseases, they are increasing. They are increasing in Nigeria, but they are not increasing at the same rate. There are some population that with some populations with higher rates than others. That we suspect that say the prevalence of diabetes may even be higher in the north. So you can do the study in a different population. And then the fourth one is if it has been a long time since the previous study was carried out, what they call a circular trend. Okay, so we will go through these 4 conditions, one after the other. The first one is to reflect new criteria, new diagnostic criteria. When this great guy, Akin Kugbe, when he and others did a national study in assessing the prevalence of hypertension in Nigeria, they used a cutoff for hypertension at 160/90. But right now, the current definition of hypertension is 140/90. And because of this reduction, his studies, that's his prevalence studies, those prevalence studies are no longer tenable. Okay, So in this case, now you will need to, all the studies carried out they need to be repeated. They need to be repeated. Okay. So that is it. Okay. That is it. So we now have a new criteria for diagnosing hypertension. Okay. Then the other one is if you want to use a different methodology. For example, now most of the studies on that on abortion in Nigeria were done in tertiary hospitals. We are done in big government hospitals. So because of that, it is suspected that they don't give the full picture. Because it will be only those that can't afford private hospitals that will go to public hospitals after having an abortion. Okay, so the abortion rate, if you do the study in a tertiary hospital, will be different from if it's done in a community. And I'm sure that in epidemiology, they told you what they call the iceberg effect. In fact, perhaps even in that, some of those courses, one of those courses in health system management, they would have taught you what they call the iceberg effect. Iceberg, that the cases seen in a hospital is just a fraction of the whole. Not everybody. Because if people are sick, at times some of them are subclinical. Some of them will not cause symptoms enough for the patient to seek treatment. Some of them will cause symptoms, but the patient will prefer to go to buy drugs from the chemist. Others will prefer to go to private hospitals. Others will go to other hospitals even outside the health center and so forth. So if you go to a health center and do a study, you are only studying just the number, just the people that came to that health facility. So there's difference between hospital-based studies and community-based studies. We have to note that. Okay, and then we have to also know that not all studies are the same. We have told you to do cross-sectional study because of time, but cross-sectional studies, you can only do associate. You cannot prove effect. You cannot say that something is responsible for another thing with a cross-sectional study. You can only do that with, say, other studies, like especially intervention studies. Okay, so you can, if a previous study was a cross-sectional study, you can improve. You can do an intervention study. You can do an intervention study. Okay. The other one is you can repeat it in a different population. We have said that about hypertension and diabetes. Hypertension and diabetes, a lot of these non-communicable diseases, they are increasing. Their prevalence are increasing, but not at the same rate. For example, I've done a lot of studies on hypertension. I've done amongst lecturers, and I noticed the same prevalence of about 27% between lecturers and clergy, In fact, lecturers and clergy are almost the same. Almost the same. Then, but the one I did that was done amongst traditional rulers, they were probably twice the prevalence. And that prevalence was, what was the prevalence now? The prevalence was very, very high. Very, very, very high. the preference was very, very high. Okay, so which means you can do the study, the same hypertension study, but in different study population. And then, okay, and then if the study has taken, if it was done long ago, you can repeat it. You can repeat it to reflect the circular changes. And one of an example I like to give is the uptake of cervical cancer screening. When Ikimalo and Babatunde did that in the early 2000s, they noticed the uptake was very, very, very poor. But they have done a lot of interventions have been done, including that done by INWAN. And so it is expected that the uptake would have increased. The uptake would have increased. So you can do a study on the uptake of cervical cancer screening. Okay, then anything you see, you question. Anything that is of interest to you, you question. Okay, anything that is of interest, you question. Okay, so yes, you question. As you go about, you have to question. Okay, you have to question. Yeah. Okay, you have to question everything. Then from lecturers, you know, I'm sure that once in a while you will have in some places they have this postgraduate programs can be free, can be tuition free. And even if it is tuition free, it's because the lecturers, they have probably they have a grant, research grants, and usually research grants are best conducted by getting a postgraduate student to do it, to carry it out. So if you get a grant in developed countries where most of the earnings of the lecturers come from grants, it's usually their postgraduate students that carry out those research. So which means that topics can come from lecturers. Topics can come from lecturers. But as much as possible, we'll try to. But right now, in as much as we have some of us, like I'm personally interested in something like the processing of our staple foods. So which means that I have one or two topics. I have one or two topics. Well, at times we try to discourage them. At times we want to discourage this because we don't want a situation where if a student runs into trouble with carrying out his project, he'll begin to blame it on the lecturer, that the lecturer gave him or her a very difficult research project. But you must be assured that if you are working, if a lecturer gives you a topic, especially the topic is interested in, the lecturer is also willing to help you do it. For example, I was interested in assessing the glycemic quantity of gari and fufu sold in the Nigerian market. Yes, and these topics were given to 2 students, and I think I can remember paying for the analysis of their samples. Yes, paying for the analysis of their samples. So if a lecturer gives you a topic, especially a topic that is interested in, he or she will also work closely with you to see that that research study is carried out very well. The other step we talked about is known unknowns. Please don't waste your time. You can only measure, you can only study what you can measure. You can only study what you can measure. So if you cannot measure anything, if you cannot measure something, you cannot say you want to study that thing. For example, angel, we gave you an example of an angel. How many angels can dance on the head of a needle? Used to be a common question used to be disputed by clergy philosophers in the medieval period. I don't know. In fact, anyway, they didn't have much to do. So, but how can you decide? How can you study that when you have not seen an angel? You don't know the anthropometry of an angel. How can you determine that? How can you determine that? Okay, there are also some studies that are unethically unacceptable. Those that involve human experiments, they are not acceptable. They are not acceptable. You cannot, for example, you want to find out if you cannot withdraw, we cannot withhold a useful medicine from patients. You cannot, and that is one of the reasons why your research proposal. That is one of the reasons why it must go through the ethical committee. It must go through the ethical committee for them to ascertain that you are not putting anybody at risk. You are not putting anybody at risk. And then the study must be worth your time. So there is actually no need. It's of no use if you are carrying out a study that you already know. You already know the answer. If you already know the answer, then there is actually no need carrying out the study. At times they talk about the contribution to knowledge. What you do, what you study should contribute to knowledge. What you study should contribute to knowledge and should contribute to time. Contribute to knowledge and yes. And then we're also saying that it has to be measurable. I don't know if there are questions or comments. Okay. I think a hand is up. Where is the hand?
Yeah, Prof. I raised my hand.
Okay, go on.
Okay, thank you, Prof. My questions are around because what I've been shown so far, there's a slide that talked about the results accepted must have at least two tables that talks about bivariant analysis. I want to ask, does it mean that qualitative method research are not accepted?
Which one? Qualitative?
Yeah.
Is it qualitative or yes?
No,
no. Qualitative is you can do qualitative. But to tell you the truth, we are biased.
We
are biased. If you do a qualitative, we like to see tables. So let me just tell you, but qualitative methods are good. They are acceptable. But we rather prefer what we call the mixed method, where you use both quantitative and qualitative.
Okay, that's fine. Because I asked you because I know that you cannot do inferential analysis with just word to word and the qualitative analysis.
Yeah.
Okay, thank you.
Yeah. Okay. Amara Chupu.
Good evening, Prof.
Good evening.
Okay, I want to. My question is, what if we chose a topic that we are interested in and then we submit it, but our supervisor, maybe they might have a topic they are interested in and they want us to do that topic, but we are not interested in it?
No. No, I think we'll give you the right of refusal. It's your work. It should be a project. they can only persuade you that, oh, just do this. You do this, I will assist you. But I know that there are some persons. Anyway, the way we do our own is that you will submit the topic. In fact, that is what we are going to discuss in the next lecture. We expect you to submit a topic, probably 3 topics, and from those 3 topics, we'll approve one, and then before we assign the supervisor is assigned after you have chosen your topic. Okay, except you are meeting, you want to meet the supervisor, the person privately. Like right now, we'll tell you, we'll tell you to send in 3 possible research topics. This is the period you can reach out to them to find out, oh, do you have any topic? Can you suggest a research topic I can do? Then it is at that stage that they can make their they can suggest. Okay. Do we have any other question? Okay. I think if there is no other question, I think we are almost we will soon end. But just to say that tomorrow we are going to look at okay. I think I have 1 or 2. Yes, we have not finished. Okay. So the other thing too is that just to say that within the next 1 week or so, we expect you to submit 3 topics. In fact, we are going to create a Google form before the end of the weekend, before the end of the weekend. And that Google form, you will be given up to, say, 7 to 10 days to make available 3 possible research topics. And from those 3 research topics, we are going to approve one for you. Okay? And so I must also say that perhaps we have to give you an idea of what a topic is. A topic must have a subject. A topic must be measurable. And a topic must have a study population. So you have to have the subject, and that subject must be measurable. And then you must include a study population. Please just note those 3 conditions. You have an area, a research focus. That research focus must be measurable, and then you must have a study population. Okay? And so how do you get this topic? The first thing you think about, which area do you want to carry out your study? Which area do you want to carry out this research for your master's degree? Which area? Please, it may not be an area where you like. It may not be an area where you like, that you enjoy most. Is just think of an area you want to add to knowledge, or you are an area that you are confused about the happenings, or an area you want to find a possible solution for. Okay, like for example, now I'm interested in how to make food, our staple food, good enough for the management of common communicable diseases, like non-communicable diseases like diabetes. So how do I? So that is my problem. So that problem is, so to make it measurable is what will lead me to what they call the glycemic index. Glycemic index is the ability, is how fast a food raises the blood sugar level. Okay? Okay. So the research will be probably various ways of reducing the glycemic index. Various ways of reducing the glycemic index. Okay? So please note this. Note the area you want to carry out the study, ensure that what you want to study is measurable, and then decide on the study population. Okay? So those three things you have to take into consideration. The research focus, ensure that it's measurable, and then let it have a study population. Please have, study population is very, very important, especially where you want to carry out the study. We may, don't give us work, especially when we are approving your topic. Please include the study population. Because if I see a didn't, I will just conclude that, oh, the person is from either Akwa Ibom or Cross River. So I will now put the study population to be Cross River. And they may be in Abuja, but they may even be abroad. So that's why it is good for you to include the study population. Okay? So we are going to create the Google form, and we expect you to do that. We expect you to please send it within 7 to 10 days, so that we'll be able to approve the research topics. If we approve the research topics, the target is to assign supervisors to you. Assign supervisors to you, and then so that by the last week of January, first week of February, we should be having the proposal presentations. Okay. Hello, Cyril. Cyril, your hand is up. Yes.
Yes, sir. You're just talking about study population. I just want to inquire with respect to the population. What is the minimum? Like when we are talking about sampling of the population? Is it possible that we sample based on the population size? Is it possible that we sample the entire population for a particular study?
No. Don't worry. Just put your study. Just put just a study. Just the place. Okay. The place you want to carry out the study.
Okay.
Just the place you want to carry out the study. The sampling method we are going to teach you.
Okay.
Yes, but a sample is representative of the total population.
And
we have different sampling methods.
Okay, sir.
Okay. Hello, Henrietta. Hello.
Yes, good evening, Prof.
Good evening.
Yes, Prof. I want to ask a question because there was a topic I picked during my PGD, and I feel I want to continue. Although I will change it, but I just want to be on that line. Will it be allowed?
Yes.
But it's still the same problem on the ground, and we are looking for a solution. Okay, sir.
Yes. After all, you have done literature review, so you can build on it.
Okay, sir. Yeah. Okay, sir. All right. Thank you, sir.
Okay. Thank you very much. Tomorrow we are going to look at the supervision, assigned supervision, and we are going to tell you about the changes we have made to deal with the large number. We have we'll be sharing you out to research teams, and those research teams will take over everything, your supervision and everything. And then the other thing we have to say is that we are officially extending your stay with us beyond the third courses. Beyond the third courses. So next year you will stay with us, and yes, but the lectures will not be regular like this, maybe once in 2 weeks or in a month, but want to teach you like this course, this research methodology course, we are going to stretch it over several months, and we'll teach you at the point of need so that you can just apply the knowledge. So that's why we are ending at choosing a topic and research proposal, because that is what we are going to end. That is where what you need this period, and then it continues. Cynthia. Hello, Cynthia.
Good evening, sir. Sir, please, my question is not related to what you just taught us. I don't know if I should ask. The question is, sir, please correct me if I'm wrong. I think during our orientation, you said those that did PG that they should not bother about sending transcript again. But I've been getting a call from the school asking me to resend that I need to send another one.
No, I don't know. Perhaps I have to take it up with the what is it? With the admin. What is done, because we are the only thing is that our graduate school has their transcripts. Unfortunately, they want you to still pay something to move the transcripts. From one corner of their room, from the PGD cabinet to the master's cabinet. So that is the only thing. But I have to take it up. They have to. They have to make changes. They have to change the way they communicate. So if you have a PGD, they should not tell you exactly what they are telling the other people.
Okay, sir. Thank you.
Yeah. Okay. Ogochukwu. Is it?
Good evening, sir.
Yeah, good evening.
Okay, sir. Mine is not actually related to this topic. Okay, let me share 2 questions. I know we have not gone to that supervision aspect. Maybe probably you answer the question there. Are we allowed to choose our supervisor, or the school will choose for us? That's number 1. Then number 2, what about our elective courses? Most of us took elective courses when we were registering for our courses. When is it going to be taught? Is it after this research methodology we continue with other courses? Thank you very much.
Okay, thank you very much for if you'll be allowed to choose your supervisor. The last time we in fact we have been allowing people, but we noticed that we are choosing people that are not competent enough. Are not competent, almost like placeholders, and they are not contributing. And we are reaping the benefits. Sorry, should I say the benefits in the current defense we are holding. So, but what we are trying to do is that we are going to divide you into, post you to the various supervision teams we have created. And the supervision teams, they have a lot of persons. And it will be the supervision team that will determine if you need a supervisor. You actually need a supervisor in certain circumstances. For example, if you are going to, for example, in our teaching hospital, for you to be allowed to access their records, you must include one of the consultants as your supervisor so that they benefit from the article that will come from it. Okay? And we have also realized that the best way for people to grant you access to data is to make their Oga one of your supervisors. So that we are reserving it for that purpose. So it will not be a generic that will force everybody to have their own, but the person you are bringing should be able to add something, value to the whole thing, and not placeholder, and not bringing somebody because you have been told to bring a supervisor. Okay? I hope I answered that. Then for the third courses, for the electives, they are going to also come. We have converted them to short courses, and we are working on them, and the timetable will be sent out. Okay. So you may, the only thing is that you may need to re-register. You may need to re-register. Okay. I hope I answered that. Hello, Henrietta, yes, your hand is still up.
Yes, so Prof, I just lifted it down. Sorry, sir. Yes, about what the person asked about transcripts. I didn't really understand that last part of what you said.
No. The thing there is this, that technically you don't need a transcript if you graduated from a school. But the thing there is that, the university, they have a way, they are interested in IGR. They use every opportunity to generate IGR. So I was just saying that if perhaps they want you to pay a fee. This fee is paid to the graduate school, because it's the graduate school that has the transcripts. Our own is to do the training. It's the graduate school that awards the certificate, and they have the records. So I was just saying that perhaps the money they will ask for you to pay will be to move, to take the transcript from the PGD cabinet to the master's cabinet. So which means that you'll be asked to pay money for transcripts, and that settles it.
Up to 20,000.
That's what they're saying.
I've paid that. We have a list. I don't know. I will send you the list, sir. I'll just send you the list and what we are passing through. I'll do it to you. I'll send it to you personally. I don't want to say it here. Thank you so much.
Okay, it's all right. Thank you very much.
Thank you.
Okay, it's all right. Thank you very much. And I must say that I think black ships are beginning to emerge. But as I will keep saying that we treat you people as clients. We treat you people as clients, and as much as possible, we'll try to protect you from the wolf. We have a lot of them in the university setup, but we will try. We'll try. Thank you very much. Tomorrow we are going to say something about this. The supervision, we'll say something about supervision, and then we kick off. And then the other thing too, we're also saying is that assessment will be at the end of every week. At the end of every week, which means that if we finish, I don't know, on Monday, you will do, you will just go probably on around 6, around 6 to 7 or to 8. You just go to the exam platform and answer about 20 questions on what you have been taught. We are going to give you those questions. I think the objective is to ensure that you pay attention. You pay attention, and we have realized that if without examination, a lot of you will not be attentive. Okay. Hello, Eze.
No, good evening, Prof.
Yeah.
So mine is your one acknowledgement for your time and every support you've given us so far. But I'm just trying to see if I could really chip this in, because I think earlier this class was actually scheduled for 6:30, but unfortunately it did start very much earlier. And we had a discussion with the course rep to say that very many of us could really be very busy at work. And then if you've not checked your WhatsApp today early enough, you will still mix this lecture. And I count some of these things we do, particularly this section of this lecture, very important because very many of us don't have so much idea around that. And then if you miss any class, it becomes a whole lot for you. So I wouldn't know if there is any particular way we could really solicit with you to adjust the timing to see if it suits every other one. I wouldn't know if it's something you'll be happy to do, please.
Yeah, actually, the class rep will understand. It was originally advertised for 4, and we had to reduce it. We have to make it 5. So that is it. And yeah, so we just and it's not every day now. Okay.
So yeah, I'm not saying it's every day. It's just about schedules. But notwithstanding, probably if the audio will still be sent out, but I think there will be chance for us to ask questions if we join on time.
No. What I'm saying that this one is starting by 5. So for this course is 5.
Okay.
Yes. Okay. Thank you.
Now the last bit of Fent, there's this concept in this short courses about systematic review and meta-analysis. Can it be done online, or is it only for those who can come to the campus?
We although the short course used to be that of our sister center, but well, because we have made it. We are making it the cornerstone of an important part of our PhD. So we are going to do our own. And our own, what we do, we spread our own over weeks, so that people can be assessed. They have time to go and practice, and then yes. So we are going to work on that too. Do our own short course on systematic review.
Oh, thank you very much.
Yes. Yes. Elizabeth.
Good evening, Prof. Good evening, Prof. Good evening, everyone. Okay, thank you, Prof, for the time and for the clarifications or explanations. So I want to ask, these elective courses that are now short courses, are we going to be expected to pay on registration?
Okay, short courses are certificated separately. So you will pay, but the thing is that the School of Public Health is working out at least a discount for each student. It may be that one may be free, but the others, if you are taking two of those short courses, you may have to pay for it. But at least one will be made free for everybody. Yeah. Okay. Because to tell you the truth, the electives are not part of your CGPAs. The elective is not part of your CGPA. Yeah. Amarachuku. Hello?
Yes, Prof. I want to ask, in our course schedule, the elective has 2 credit units. Now, when we do them as short courses, we have
technically removed them. In fact, we have removed them. They will not be counted in your CGPA because you will receive a certificate upon the successful completion.
Okay, Prof, I have another question now. Is it optional? Can someone decide not to do them since it doesn't have a unit accredited?
It is optional. It is optional.
Okay. Thank you, Prof.
It's optional. Yeah, because as we said, as much as possible, we want competencies. They are competency-based lectures, courses, competency-based courses. Okay, thank you very much. So tomorrow we are going to look at supervisions, and then between now and next week, between now and over the weekend, we'll send a Google form for you to put submit your topics. Please respond. I know one thing I've learned that deadlines don't mean anything to some of you. In fact, some people like to break, like they like to go against deadlines. They like to go against deadlines. So, but we just pray. We just pray. You know that the number is much, so but we are interested. We want to make sure that, in spite of the number, we are able to conclude this program on schedule. So the best way you can help us is to, if you ask for information, please respond so that we can conclude and then move on. Cynthia, Emerald.
Good evening, Prof.
Good evening.
Good evening, sir. Good evening, everyone. Please, mine is just a different question. It's about our results from the second exam we wrote previously. So I don't know when it will be ready, sir. That's my question.
Yeah, results will be ready. You know, they have same MCQ, their CBT listing. I'm sure that you have an small idea of what your score is. But it will formally be released. It's just that, yes, it's just a way of just putting them up, and then adding whatever CA, and then they will be ready. So no problem.
Okay, sir.
Yes.
Okay.
Thank you very much. So any other questions should be tomorrow. So at least we'll be able to spend up to more than 1 hour tomorrow. Thank you very much, and have the best of the rest of the evening. Thank you.
Thank you, sir. Thank you, sir, for a wonderful lecture. Thank you. Good night.
Thank you.